Before we really even understood how the coronavirus was transmitted, you anticipated that communities of color would be impacted disproportionately, as I'm sure all of our panelists anticipated. How did you know this?
I think history has been our best guide at how disasters, both man-made and natural, disproportionately impact vulnerable populations.
When we think about what we like to now call the social determinants of health, they are not new. This is the stuff that's been killing us for hundreds of years. And those things have made Black and Indigenous and people of color populations disposable.
This pandemic has hit certain communities harder than others. And we also know that whenever there are policies that are unfair, that hurt some in the community, those who are affected the most are always those who have the fewest resources.
These factors that create a perfect storm that have been talked about for months now, which include multi-generational housing, densely populated areas, essential workers, the need for public transportation. Before, we were telling people to mask, language barriers, concerns around immigration, mistrust.
We really have to look at the impacts of racism as a system and how are we using race? How is it causing harm? What are the intended consequences? And what do we need to dismantle this aspect of bias that is built into how we deliver care?
We are at the beginning of this, massive nationwide vaccination effort, and many health officials have put equity at the center of their distribution plans. What kind of doubts are you hearing from your patients, and what kind of plans are you making to try to counter them?
Understanding where people are coming from and accepting where they are and meeting them where they are is going to be a really important part of that. I think part of establishing trust is also going to be proving that we are trustworthy. And that also includes being attentive to our patients' other needs.
How will we, particularly now going forward, begin to allocate resources to the places where they're most needed, not where they most wanted?
I think there's a lot of concern and blame gets placed on people, right? For why they don't do things or why they don't get vaccines or why they don't take medicines. But we need to acknowledge that these fears and concerns are rational. It's a lived experience.
We need to stand up and demonstrate, hey, I'm doing this, but not just doctors, nurses, all role groups doing it together.
During this pandemic, we've all seen the fractures that exist in our society, Black and brown communities, others that are marginalized. And yet during this period, we've also seen the opportunity to look at ourselves and look at what can be accomplished. We've made a commitment to elevate diversity and inclusion